Welcome to this training series on employment equity offered by YWCA Canada with support from the Government of Canada's Department of Women and Gender Equality and the Future Skills Centre. The way we work has changed. This requires managers to lead with emotional intelligence and empathy, and companies to think intentionally and creatively about their equity commitments and employee engagement. In this session, we unpack what it means to be trauma-informed as an organization and how workplaces can build environments that cultivate safety, trust, and compassion that ultimately lead to diverse and productive teams. We do a land acknowledgement to honor the First People. We are acknowledging the enduring presence of Indigenous peoples in this area for time immemorial. In doing so, we must also recognize the harm that settler colonialism has perpetrated and continues to perpetrate on First Nations, Inuit, and Métis people. As we engage online, let's remember that the digital spaces that we occupy are often used as a tool of oppression towards Indigenous women, racialized women, gender and sexual minorities, people with disabilities, and others who experience intersecting forms of marginalization. Let's do our best to create a space where we can all safely engage. For over 150 years, YWCA Canada has worked to advance gender equity by responding to urgent needs in communities through national advocacy and grassroots initiatives. Today, we engage young leaders, diverse communities, and corporate partners to collectively achieve our vision of a safe and equitable Canada for all. The information presented in this training module is rooted in on-the-ground experiences of the YWCA Canada movement and reflects the needs, expertise, and wisdom of the women and gender-diverse people served by YWCAs across Canada, a national leader in employment-focused programming, along with contemporary research from thought leaders in equity, inclusion, diversity, and justice in employment. The YWCA Canada movement has been at the forefront of providing critical frontline services and programs from a trauma-informed and harm reduction approach. YWCAs across the country work to advance gender equity for women and gender-diverse people. This includes enabling women and gender-diverse people from marginalized identities and equity-deserving groups to achieve their full potential and improve access to meaningful work. YWCA promotes inclusion and cultural and psychological safety in the workplace. We do this by working with partner organizations across sectors to build workplaces where people are respected and feel safe. Here are some learning objectives to help guide and orient us through the content ahead. The session will help us define trauma and recognize the distinct ways it can present in workplaces, how to plan for it in policy and practice, and understand the impact of trauma on workplace behavior and performance. From that place of understanding, we will describe the fundamental principles guiding trauma-informed organizations and offer strategies to effectively apply trauma-informed approaches and identify and surface needs or resources. Our primary goal is to lay the groundwork so that everyone leaves the session looking at workplaces and policies through a trauma-informed lens. Training or talking about trauma is never easy, especially in an asynchronous format. So remember to check in with yourselves, pay attention to cues about how you're feeling, and take deep breaths or breaks from the material as needed. What is trauma? The Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services offers a three-dimensional definition of trauma: an event, series of events, or set of circumstances, including exposure to violence, suffering, scarcity, living through natural disasters, war or conflict, physical and emotional distress, gender and sexual violence, environmental crises, political instability, death of a loved one, childhood abuse and neglect, discrimination, and intergenerational trauma that are experienced by an individual or group as physically or emotionally harmful, threatening, or chronically stressful, and has lasting adverse effects on mental, physical, social, emotional, or spiritual well-being that may appear immediately or be delayed, may be short or long-term, and don't always appear to be clearly linked to the original trauma. An estimated 76% of adults in Canada report being exposed to a potentially traumatic event at least once during their lifetime. Research has shown that people exposed to extreme, prolonged, recurring trauma, or chronic stress can develop post-traumatic stress disorder, PTSD, a clinical disorder in which individuals may experience intense or intrusive thoughts, flashbacks, fears, or chronic fatigue. The Canadian Mental Health Association indicates that 1 in 5 Canadians in any given year will experience a mental health issue or illness. By age 40, 50% of the Canadian population will have experienced a mental illness. The collective and ongoing trauma from having lived through COVID-19 related isolation, illness, loss, financial distress, furloughs or firing, remote work and virtual school, and increased care responsibilities, food insecurity, domestic violence, and racial injustice have left many at risk of being unable to cope and function at their best. Public traumas, such as those associated with gun violence, war, or the pandemic, are something we all recognize and openly discuss. And yet, there are also undisclosed traumas happening behind the scenes all the time. Racism, divorce, and other familial losses are silently but surely affecting our workforce, even if we don't discuss them openly. What place does trauma have in the workplace? Trauma is part of the human experience and will present in some form at some point in every workplace. Organizations are not staffed by robots or powered by artificial intelligence yet. So the workplace is where we spend many of our waking hours. No wonder stress and trauma frequently show up as we navigate the work environment. Every day we show up to work with lots on our mind. Worries, concerns, stresses, or challenges that arise within and outside the work environment. For some, this can be outwardly displayed in their work performance and behavior. When someone is coping with trauma, it may impact their work performance or behavior. It can be difficult for them to engage. They may appear tired, distant, disconnected. They may have trouble with tasks, find it difficult to concentrate, follow instructions, schedule or remember meetings, and may even get into arguments. Early traumas have been shown to have lasting impacts on educational attainment and economic outcomes. So trauma has a very real part to play in who can access work and who gets to thrive and succeed. Whether an individual is dealing with external stress, or their workplace is the source of their trauma, or the workplace is their trigger, it is key to recognize that trauma entering the workplace is inevitable. While trauma can present in very obvious ways, it goes beyond observable behavior. It is important for organizations and managers to recognize the subtle signs and trauma responses that fly under the radar. It may help to think of this as an invisible suitcase or satchel that people carry to work, a collection of beliefs, burdens, stressors, emotions, and expectations that people bring into the workplace as a result of exposure to trauma. It can be filled with mistrust in the system, of not feeling safe or supported, being passed over for a promotion or salary bump, concerns around health and accessing and affording healthcare or insurance, worries about job stability and employment precarity, grief about loss or illness, and fears about bills and debt. Some days it feels heavier, some days the load is lighter. This invisible trauma baggage impacts and influences every employee's well-being. More than ever, trauma is showing up at the workplace. Employers report increased conflict and loss of motivation. In fact, for those whose roles went remote or hybrid, possible return to in-person work could be further traumatizing. Experiencing unfairness, unrelenting criticism, being met with unrealistic job demands or expectations, constant threats or worries of job loss, or other forms of precarity or unpredictability in leadership transitions or co-worker engagements can also cause feelings of trauma. Gallup's 2022 report on the state of the global workforce found workplace stress at an all-time high. Risks to people from exhaustion, burnout, and deteriorating mental health are among the greatest challenges to organizational well-being and profitability. Managers need to be trained and practice a higher level of empathy to see beyond the immediate signs and symptoms of stress and trauma in the workplace. Let's think about what shows up at work and what may really be going on. Employees may call in sick often, or just not turn up. What may appear to be tardiness or absenteeism could be linked to stress-related sleep struggles and worries about kids, debt, or job insecurity. What may present as bad interview skills may be a defense against trauma triggers. Lack of eye contact could disadvantage a candidate in an interview. They may seem to lack confidence or appear deferential due to prior experiences of abuse from authority figures. High turnover may be linked to chaos experienced in employees' personal lives. An employee may find it difficult to maintain employment, letting personal disruptions get in the way of their professional commitments. They may be dealing with a toxic, abusive relationship. Pre-pandemic, it may have seemed easier to separate people's personal lives from their professional life and expect that when people come to work, they're professional, focused, and productive 100% of the time. With the sustained trauma and chronic stress that we've all been experiencing recently, employers cannot expect the same levels of focus and productivity without appropriate adjustments and accommodation for how fragile and depleted employees are feeling across the board. This has certainly always been true for first responders, frontline and essential workers such as police, firefighters, paramedics, shelter staff, healthcare workers, and community organizations providing services directly to the public. The pandemic made trauma experiences more fraught and more frequent, and this has given a better understanding of just how widespread and prevalent trauma can be. BIPOC populations in occupations such as retail work, cashiers or bank clerks, and taxi and rideshare drivers, for example, have been reporting assaults and altercations at increasing levels. PTSD can occur in response to the direct experience of extremely traumatic, stressful events or bearing witness to people involved in them. This can present as secondary or vicarious trauma or compassion fatigue, especially in the social services and nonprofit sector. While experience of trauma may be visible in these types of work settings, research has revealed that complex trauma can result from common occurrences: witnessing a car crash or a crime, sudden job loss, the discovery of a serious illness or health condition, and the leading cause of PTSD within the community, sudden unexpected death of someone you care about. With these experiences on the rise, the Public Health Agency of Canada says mental illness is experienced directly by 1 in 3 Canadians during their lifetime, and many more are impacted indirectly through family, friends, or colleagues. Trauma tools and training are now recognized as necessary for all private and public sector employers and employees. Many workplace signs of trauma are linked directly to physical and psychological symptoms of trauma. Employees may have trouble meeting deadlines because they're having trouble focusing and cannot concentrate. They may get into arguments or have angry outbursts because they're prickly, easily irritated, and feeling on edge. Employees may forget meetings or instructions because they're having memory loss or challenges. Employees may turn up to work tired, disheveled, or under the influence. Trauma and PTSD often come with sleep-related issues, such as insomnia because of nightmares and hypervigilance. Nearly half of individuals with PTSD turn to alcohol or substances as a coping mechanism. Employees may seem disinterested or no longer contribute as much in meetings or teams. This may be linked to disassociation, a form of mental escape when an individual is so emotionally overwhelmed that they distance themselves when they cannot cope any longer. The default is to view these behaviors through a performance lens, where the objective is discipline or correction. The use of a trauma-informed lens enables recognizing signs of employee distress and responding with the objective of offering support. Looking through a trauma-informed lens means being sensitive to the impact of trauma on others and yourself. Understanding and utilizing tools to support self and others in regulating during times of stress, as well as identifying and supporting the system change needed to reduce re-traumatization. Exploring ways to create a safer, more emotionally supportive, and ultimately a more productive work environment requires a move from narrow results-oriented frameworks to resilience-oriented workplaces. So what could this shift look like? Workplaces that place productivity, sales and profits, deadlines and deliverables before all else, where bottom lines matter more than personal health or balance, lead to employee burnout or turnover, and stifles creativity, optimism, and trust. When an organization can provide consideration, accommodation, and compassion to its employees' personal wellness, work-life balance, and support, these workers are empowered to provide the same level of support and attention to the communities and clients they work with, thereby resulting in improved outcomes and quality delivered. The approach we're taking isn't focused on building the resilience of individual employees or the workforce, but building resilient and responsive workplace systems at an institutional level. We've got to talk about why we don't feel safe enough in our workplaces to have the hard conversations that help us move forward together. People struggling with chronic stress or the stigma of trauma can feel the need to mask their distress and dysregulation in the workplace. We've all had days where we try and appear more put together than we feel. But what about creating opportunities where we feel like we can candidly say, I don't have it in me to perform at my usual pace. I'm struggling and need support. To feel psychologically safe, we must know that we can be free enough sometimes to take risks around other team members, to share the things that are messy or sad or aren't the most well thought out. Google conducted an internal study that showed the number one factor in determining whether a team would be effective or not was a sense of psychological safety. The 4R rubric is helpful to describe and develop a trauma-informed organization, program, or system. Realize, recognize, respond, and resist. Realize the widespread impact of trauma and that trauma impacts different people in different ways. In spring 2021, 1 in 3 Canadians said that their mental health had gotten worse since the pandemic started. This was disproportionately felt by Black, Indigenous, and people of color, women and gender-diverse people, low-income earners, workers in healthcare, caregivers, 2 SLGBTQIA+ communities, seniors, and those single and living alone. Think about the additional support that may be needed for specific employee groups in your organization. Recognize the signs and symptoms of distress. This requires training, practice, and empathy. Think about your workplace. How do you recognize when someone is distressed and struggling, or in crisis? Clues about someone's emotional, physical, and psychological wellness are often communicated through their words, body language, or actions. These can all present differently based on the circumstances or context, or whether someone is a child, adult, or frontline worker or first responder. Knowing how to screen for trauma is the first step to adequately referring someone to the right care or services. Common warning signs of emotional distress can include eating or sleeping too much or too little, being socially withdrawn, and pulling away from people and events, fatigue, having low or no energy, having unexplained aches and pains and constant stomach aches or headaches, feeling helpless or hopeless and losing interest in daily activities, excessively smoking, drinking, or using substances, including prescription medication and drugs, worrying a lot of the time, feeling guilty but unsure why, thinking of hurting someone or yourself, having conflict with peers, facing difficulty concentrating. Some warning signs and risk factors for first responders and frontline workers may include experiencing rapid heart rate, palpitations, muscle tension, headaches or tremors, feeling fear or perceiving danger, outsized anger and frustration at authority, being disoriented or confused, engaging in problematic or risky behaviors such as failing to use personal protective equipment when necessary, becoming irritable or hostile in social situations, resorting to blaming, and failing to support teammates. Identifying these signs can help direct people to the right interventions. Respond empathetically by fully integrating knowledge about trauma into policies, procedures, and practices, and by meeting workplace challenges with openness and willingness to support. This reinforces psychological safety and increases the likelihood that the employee will ask for and access support if needed in the future. Think about a time you were mildly, moderately, or severely stressed. What did you need? What were some responses that weren't or wouldn't have been supportive in that moment? Sometimes survivors are not looking for solutions, for someone to fix their problems, but someone to authentically respond and actively listen in a way that makes them feel heard and held. Actively resist re-traumatizing and causing additional harm. Work environments can commit to avoiding triggers or events that can provoke distress or flashbacks to previous traumatic encounters. But it's hard to tell what can remind someone of their trauma, and even harder to control those factors. It could be the sound of a siren, fireworks, the use of certain phrases. Since there is no way to distinguish survivors from non-survivors, universal trauma precautions are key to reducing harm and providing positive support for all people. Embedding universal trauma precautions and harm reduction strategies are critical in all aspects of policy and practice. When employers implement new policies, update existing ones, launch new initiatives, and respond to workplace issues. How do organizations navigate trauma effectively? Here are some principles for implementing a trauma-informed approach. The Centers for Disease Control and Prevention identified 6 guiding principles for a trauma-informed approach. Promote safety, physical, emotional, and psychological. This includes the physical setting, having an environment that is inviting and welcoming and doesn't pose risks or barriers to anyone. For instance, having parking that is ample, accessible, and nearby for all employees. It means organizational policies that understand and uphold safety as defined by the people they serve. This could look like having COVID-safe spacing and masking policies for in-office workers, and an advocate to liaise for anyone who might report workplace violence, harassment, or discrimination. Trustworthiness and transparency in communications and relationships. Positive regular interactions can promote trust by ensuring employees and clients are kept well informed about changes or updates to programs or operations. Peer support. While one-on-one support is essential, there may be benefit in supplementing this with spaces to share and support each other in group settings. Individuals with lived experience of trauma often respond to stories of other survivors in their recovery. This can instill hope, fast-track healing, and prevent and reduce staff burnout. Fostering collaboration and mutuality. This looks like partnerships that are based in meaningful sharing of power and decision-making, that clients and colleagues are encouraged to contribute and be active participants in shaping organizational programming priorities. Empowerment, voice, and offering choice, building in flexibility, recognizing that everyone is showing up a little differently every day and may have different needs. Individual strengths, resilience, and experiences should be recognized and built on through staff professional development and capacity building, and clients supported in shared decision-making and goal setting to determine their course of action. Attention to cultural, historical, and gender issues. Services and support should be gender responsive, culturally resonant, and responsive to racial, ethnic, and additional needs of individuals served. This means services that have been adapted to maximize the respect of and relevance to the beliefs, practices, culture, and linguistic needs of diverse client populations and communities. These strategies take into account the principles of universal design. How do we collectively ensure that colleagues in our workplaces who may move around carrying varying forms and responses to trauma are not triggered or re-traumatized by their work environment, rather enabled to mitigate the risks of exposure and empowered to show up as their best selves. Catherine Manning simplifies these to three overarching concepts: acknowledgement, I will be heard; support, I can get the help I need; trust, I will be treated fairly. The organization that shows through its actions that it cares for its employees beyond the short-term profits they generate, that shows a real interest in who they are and supports them in good times and bad, will earn loyalty, engagement, and trust, and will deserve it. When most people hear the phrase trauma-informed, they immediately think about trauma-informed care, a clinical practice of treating people who've experienced trauma in ways that create a sense of safety and transparency. Trauma-informed leadership is an organizational approach to creating trauma-informed policies, protocols, and practices that support all employees. Trauma-informed leadership prioritizes the psychological and emotional safety of employees over productivity and results. In doing so, trauma-informed leaders remain patient and listen to concerns that come up during times of transition. For instance, introduction of personal protective equipment, masking mandates, and on-site testing were met with much hesitation across industries. Trauma-informed leadership could look like asking everyone what exactly was causing these emotions and issues at work, hearing and validating the concerns raised. Trauma-informed leaders take into account these worries and concerns and demonstrate the safety and results of the suggested workplace changes. Behind this approach is the recognition that people are actually more productive and deliver better results when they feel calm, regulated, and safe. Adopting trauma-informed leadership models cannot be accomplished through a checklist. It involves commitment, care, and cultural change. Rather than trying to fix problems, trauma-informed leaders work to create conditions where people can flourish. According to David Tweedy, a clinical psychologist and healthcare executive, trauma-informed leadership is a way of recognizing and honoring that how we respond in the workplace, or any setting really, depends on every individual's personal range of emotional scars, traumas, and strengths. Some appear detached during conflict, while others have emotional responses that veer on overwhelm, anxiety, or aggression. These are all personal defense mechanisms that may look different based on what we're carrying around in that invisible satchel. Trauma-informed leadership training can help individuals have empathy and compassion for colleagues and employees, and acknowledge and appreciate all responses as valid. Trauma-informed leaders are more prepared to address employment challenges that may occur for an employee who is a trauma survivor. These leaders show empathy by being non-judgmental, verbalizing expectations, acknowledging vulnerability, admitting errors and apologizing, encouraging curiosity and learning, and focusing on others' well-being. This mindset can have a powerful impact on the morale of staff. When employees feel like their trauma responses are normalized and not questioned or minimized, this fosters deep trust and security. Trauma-informed leaders give employees control by empowering them to make informed decisions. For instance, if an employee is being disciplined or put on a performance plan, a trauma-informed leadership approach might be to make sure the meeting occurs in a private space, online or on-site, that employees are given advance notice and choice of the time and location, that the individual's back is not to the door if meeting in the office, and both manager and employee are seated at the same level, that they are reminded to wear headphones if the meeting is virtual. The leader might give clear expectations of how and what the individual needs to change, along with the recognition of what they're doing well, acknowledging their contributions, identifying supports, and inviting collaboration to produce a plan for the future. This approach understands that workplace supports are not a solution to trauma, that they can supplement clinical approaches to trauma processing. This involves organizational commitments to operational change that embody and embrace compassion, appreciation, resilience, and empowerment, care principles. At the heart of trauma-informed leadership is a commitment to weaving compassion, safety, mindfulness, and collective care into the culture and fabric of the organization, and not leaning on self-care or spa days to achieve employee well-being. When we encounter a colleague or a client experiencing trauma, how do we reach across the room or the screen in a way that is intentional, not intrusive, that communicates care without taking control away from the person experiencing trauma? What are some things that help? Listen, don't fix. Take the situation seriously. Don't second guess them. Remain calm. Don't freak out on their behalf, even if it's something alarming. Be open. Listen without judgment. Follow the survivor's lead in discussing the incident to the extent they feel comfortable. Offer support over solutions. Help with practical tasks and extend support to the extent possible. Ask if they want to know about support resources and help them explore the options and choice, but allow them to choose how they engage with those resources. Make referrals or point to policies or supports if asked, but let them decide what is best for them. Don't pressure them. Normalize and validate their feelings. Be available. Give them time, space, and patience as needed. Respect privacy. Check in on them. Maybe send a care package. Invite them to get coffee or go on a walk. Sit with however they're feeling, if they need a laugh or need to cry. Acknowledge your own feelings of anger, concern, or sadness, and seek support for yourself to help process your reaction to the traumatic experience of someone you are helping. Finally, how do we turn trauma-informed intentions into action? While this may look different for every industry and institution, here are some examples to take into consideration that will help organizations step up to support employees that are struggling and those that may not appear to be, yet will still benefit. Integrating intentional leadership, strategic planning, and change management processes. Incorporating a culture of compassion and care across the employment cycle. Training on employee well-being, reducing stress, and coping with trauma. Creating judgment-free spaces to bravely talk about mental health to reduce the stigma. Regular check-in conversations and feedback opportunities. Offering choice and building flexible workplace solutions that give employees the option to choose how, where, and when they work best. Extending comprehensive benefits and practical supports to access therapy, wellness supports, and employee assistance programs. Supporting employees through needs accommodations and challenging circumstances. Ensuring performance reviews are relational, taking into account employee circumstances and strengths, and not static processes. Resources should be made available in multiple avenues and formats with frequent reminders of what is available. Rolling these out is similar to any workplace culture shift initiative. It takes the right intention, some education, policies and procedures, and commitment. YWCA Toronto, in collaboration with research partner Centre of Excellence for Women's Health, launched the Trauma-Informed Development and Education TIDE project to support the integration of trauma-informed practice as a framework centered on the understanding that many forms of violence and trauma impact staff, clients, and the broader communities served by YWCA Toronto. With funding from the Public Health Agency of Canada, this project is responding to the need for consistent trauma-informed training, resource development, and shifting of the organizational culture across all YWCA Toronto programs and services and other YWCAs across Canada. We leave you with some seeds to start the process in your organization and to do this work individually and wear those trauma-informed glasses in all interactions. What are some further resources or training your organization or teams need to respond in a trauma-informed way in the workplace? How can organizations ensure all employees feel safe, supported, and empowered? What solutions and supports have proven the most effective in your workplace? How can we advance a culture of care in the workplace that is not separate from organizational goals? How can it be supported by policies and procedures, including leadership, that extends from employee hiring and onboarding throughout the employment experience and at the point or process of exit? On your screen now is a list of readily accessible resources to dive into and explore these concepts and their implementation further. Thank you for participating in this learning module. To continue to learn with us, please check out the rest of the learning modules in this series and join our employers community of practice to connect with other employment equity champions across the country. Visit ywcacanada.ca/moveforward for more information.